Hi, my name is Aaron Shaw, and today I want to talk about elbow pain and specifically elbow pain for rock climbers. So I treat a lot of climbers in my clinic, and I climb myself, and I've also dealt with my own elbow pain from time to time. And I want to talk about how this happens and kind of some simple strategies that you can at least start doing to get through this phase of elbow pain. So first of all, when we climb, we're putting a lot of force through our hands, a lot of force through our forearms, and a lot of that force comes from, as you can see here, like a finger hold and a finger hold where all the force that's holding your hand, or a lot of the force that's holding your hand and fingers locked in, comes from the outside of the elbow. So you take that hold and you combine it with pulling yourself up into the wall, up into the solid position, and probably one of the weakest links is going to be right on the outside of your elbow. So this pain can limit how well you can climb. It can limit how well you pick up things on day-to-day activities. Typically there's going to be point tenderness right around kind of the bony part of your elbow. That's called your epicondyle. This condition used to be called epicondylitis. Now it's more appropriately named epicondylosis. And the itis versus osis, like that ending, the difference is the itis means inflammation. The osis means not really inflammation, but there's definitely tissue damage. And so the reality is that when you're walking around with elbow pain out here for a couple days, a couple weeks, kind of lingers, comes off and on, it's probably not an inflammatory process, but it is definitely a tissue damaging process. So that's kind of the bad news. The good news is that with some modifications to how you're climbing and some modifications, basically some self-care things you can do on your own, you can overcome this. A lot of the research will say that over the course of time, it'll kind of go through a pretty natural process of being painful and then maybe a little bit less painful gradually over time. Some people will seek out treatment and get a cortisone shot into the elbow, which can resolve pain for a while. I find that that's great. It will definitely resolve pain. The problem is that it doesn't heal the tissue. Just because you don't feel pain 2 days after a cortisone shot doesn't mean that the tissue is miraculously healed all of a sudden. It's just you don't feel it. So the risk is you get the shot, you go back out, you climb, you feel great. Well, guess what? You're still tearing apart that tendon. So that's one of the risks, although it's certainly in the arsenal of things to do if you really need it, or if your pain is so bad you just can't get rid of it no matter what else you do. But ultimately, the cause, just to kind of rewind, the cause is often that we're asking too much of the tissue over too short a period of time. So our tendons and muscles are amazing at adapting. If you can think about the very first day you climbed and your hands and forearms were pumped out within 10 minutes or 15 minutes, and you couldn't do anything. Fast forward, you do that days, weeks, months, years later, and now there are elite climbers who can seem to climb all day at an incredibly high level. And that happens because the tissue has adapted gradually over time. And most of the best climbers in the world are better than the rest of us in part because they do a lot of self-care stuff. So it's learning when to dial down your load, be really aware of symptoms that you may have, the first little twinges of discomfort. That's the best time to start really kind of doubling down on your self-care. So self-care can include gentle cross-friction massage around the area. It can include icing the area. And again, even though it's not truly an inflammatory process, sometimes ice will kind of decrease some of the discomfort, and it may make you even be able to tolerate some of the exercises to strengthen that tendon a little bit better. So some of the exercises that will strengthen the tendon, first and foremost, is what we call eccentric loading of the tendon. So if you think about holding a weight, so if you were to lift a weight, and I'll use this as an example. So if you were going to extend your wrist from this position, that's a concentric motion. So the muscles in your forearm are contracting, bringing the wrist up. The eccentric part is what we think about maybe as the negative of an exercise, is that letting down of that weight. So normally with people, when I start rehabbing them, most of the climbers that I work with, they're pretty strong already. But when this area is really flared up, even doing 3 or 4 pounds of just that eccentric part of the load can be a little bit too painful. So it's kind of swallowing your pride a little bit, dialing down the intensity of the weight that you're lifting. You may have to find little pastel weights that seem like they're puny and wimpy, but you have to be honest about what your body is telling you. If you're picking up a 3 or 4 pound weight and you're just doing a few of these eccentric loads through that tendon, and if your body is saying, giving you pain signals, you're not doing yourself any good. What we don't want to do is have your brain start associating every time you load your hand or your forearm that you're going to feel pain. So if you just keep pounding through that, eventually your body's going to stop even letting your muscles work really well. So one of the main analogies I think of is when you are walking through the living room and you smack your leg on the coffee table and you limp around for a minute because you can't really walk. What happens is your brain shuts down your quadricep muscle. So you get this big, beautiful quadricep muscle that's, perfectly healthy, but your brain doesn't know exactly what's going on, so it's going to shut it off while it does a systems check, and then it will turn it back on. So that example is more of a reflex, but the idea is that if you keep doing something that's going to irritate your tissue, your brain is going to start turning down even how much stress that tissue can even take. So you're going to try as hard as you can, but ultimately you're going to be getting weaker and weaker and weaker. So respect your discomfort, respect your pain, even anticipate it, use your intuition. So again, one of the tools we have is this eccentric loading. Another tool that we have as you kind of progress through that is finding something to grip. So you can simulate grips, simulate some holds even, and work on loading. So now your forearm's still engaging. These are the same muscles that are engaging. And see if you can do it in some various isometric positions. So you're holding 3 or 4 seconds, relax, changing position, holding 3 or 4 seconds and relax. Exploring all of these different reaching positions and eventually working up to positions that you normally get in when you're up on the wall. All of these should be not incredibly painful. You may feel some tension, but again, we don't want to teach your body that pain is okay. As soon as we start doing that, your body's going to start turning off your strength and you're going to feel weaker than ever and still have pain. So, isometric grip, isometric pinch, isometric kind of finger holds even. First, it's step by step, piece by piece. Eventually, it's grabbing and moving, and while you're maintaining that load while you're moving through these motions. And that gets a lot more specific to what we're doing when we're climbing. When we'll get on a hold it, pull and reach, and you're maintaining that hold while you're moving around. So all through these phases, and this is just a few of a whole bunch of exercises that I have for rehabbing elbow pain in climbers. But the idea is that we're asking the tissue to adapt. So if we push too hard, the tissue is not going to adapt. The tissue is going to continue to basically tatter and fall apart. And all you're doing is teaching your body that no matter what you do, you're not going to respect it, and you're going to break down the tissue, and you're going to get nowhere fast. So the best advice I can give you to start with is probably one thing is going to be having kind of a symptom diary. Like keep track of when your symptoms flare up. How long can you climb before you start to feel discomfort? How long before that discomfort goes away? And so at least you'll have some sort of pattern. And you have to be really honest. And I tell people to score this on a 0 to 5 scale of intensity of symptoms in the morning, intensity of symptoms when climbing, and also afterwards or in the evening. And you'll be able to start to pattern out how you respond to certain loads, to certain grades of climbing, for durations of climbing. And if you start to see this trend that's getting harder and harder and you're having more pain, you can't do quite as much, you need to kind of back that off and respect that. But if you can back some of that climbing off and focus on some self-care, maybe some of that eccentric loading, maybe some grip strengthening, and eventually dosing yourself back up so you're actually rehabbing yourself while climbing, that's the ultimate win. So I am not an advocate of telling people to stop climbing. I think there are ways you can work around it. Again, it's swallowing your pride a little bit, going back to some fundamentals. You can even do some of this training, even some of this eccentric loading of the tendon while you're up on a wall doing some things. But you just got to be smart about it and be disciplined about it. So it's easy to go harder. Anybody can do that. But if you really want to be super strong and really perform well, you need to not only train aggressively, but recover aggressively. So I hope some of this stuff made sense to you. This is just a broad overview of what rehabilitating elbow pain and climbers is about. If you're watching this, it's probably because you've had elbow pain, and there is a way to get through it. So if you have any questions, please contact me. Again, I work with climbers all the time. You can find me in a climbing gym often or out around climbing. So you can get through this, and preferably if you can get through this without injections or surgery, that's the #1 goal. So take care of yourself. Connect with me, see if you have any self-care questions for maintaining your stamina and endurance when you're climbing, and be safe out there.